Hello, Dr. Crockett and Dr. Crocker with Zeal Integrated Health, and today we want to talk about thyroid markers or labs that you can run on your thyroid to fully evaluate it. What we see in our clinic is a lot of times the testing hasn't been done to really evaluate this pathway. And we see TSH get tested, maybe T4, one of the T4 markers get evaluated, and the rest of it is just left unmeasured. And so today we want to talk about this pathway and really some things that you could test to evaluate it further. I always like to start with where the brain begins this pathway. The hypothalamus, it's going to basically create a hormone called TRH, or Thyrotropin-releasing hormone. And this is what's going to drive your pituitary gland to release TSH. And this is one test that most of you with thyroid issues have had ran. And so this is the first test that's usually evaluated. So this thyroid stimulating hormone then has a response, or it acts on the pituitary, where then it's going to drive some of the thyroid hormone production. Talk a little bit about that.
Yeah, so some of the thyroid production, once you have enough, your thyroid produces what's called T4. It actually goes on to getting converted. 60% of that gets converted in the liver. The other 20% gets converted in the gut. So a lot of times we come in and they say, well, I've got my thyroid removed, or I'm on a thyroid medication. Well, that's not the end of the story, because if you have a liver issue, if you have a gut issue, those are just a couple of the things that can still give you a thyroid problem that you're having.
Yeah, so we want to test, T4 markers, and we look at T4 free, T4 total. And you go, well, what's the difference? Well, one of them is free floating and the other one is bound to proteins. You can look at T3 the same way. There's a free form of it and a portion of it that's bound to proteins, globulins that carry it around throughout the body. So we measure these other markers to evaluate the pathway. We also want to look at things that can interfere with this. So sometimes you may want to see what the T3 uptake is. This is where maybe something like hormones like estrogen might actually bind to the proteins that are supposed to be carrying your thyroid hormone, and they block it from being able to pick up that thyroid hormone, deliver it to the cell that it's supposed to act on, and then you end up with low thyroid symptoms just because you've got too much estrogen in your system. So there's a lot of things that play a role in thyroid metabolism. Just like you were saying, liver function, the gut, we see hormone imbalances that have a role to play with this. And we just see that there's a lack of testing on these things.
Yeah, there is. It's one of the main things that we have when patients come in is they say, well, I've only been testing my TSH. My doctor says my labs look great, but I still feel this way. So if this is something that you would like, be for sure to subscribe to our videos and give us a call so that we can see if we can help you.